By the early mid-March, the government of India responded to the pandemic by involving thermal screenings of passengers from other countries, especially from the country China. As the pandemic spread worldwide, the Indian government recommended social distancing measures and also initiated travel and entry restrictions. Several businesses were shut down and ordered a widespread lockdown. States and 20 ministries, including Home, Defense, Railways, Labor, Minority Affairs, Aviation, and Tourism, were informed of the containment plan to avoid panic situations in the country. The Ministry of Textiles was to ensure the availability of protective and medical materials. The Department of Pharmaceuticals was to ensure the availability of essential medicines. The Ministry of Consumer Affairs, Food and Public Distribution was asked to ensure the availability of essentials. A government directive was issued asking all Central Armed Forces to get into battle mode, and a COVID-19 Economic Response Task Force was formed.
That we can protect
The United States has been one of the most struck countries with the COVID-19, with staggering 33 million active cases and 587,000 deaths as of this year. Health and safety departments have ordered programs to provide information, medical assistance, researchers, and government aids to its citizens. The Federal Workforce Agency have done various steps in order to protect consumers and employees while on call. Department of Education and Federal Student Aid has information for students, loan applicants, and parents. It is to extend and give opportunity to continue their education amid lockdowns. Customs and Border Patrol had issued travel and trade advisories. Also, U.S. immigration services were currently halted. It aims to inform and safeguard U.S. citizens overseas, protect the homeland, advance the administration's commitment to building global health security capacity for this and future outbreaks, and reduce the impact for U.S. companies and supply chains overseas. The U.S. has already made some steps to work with the international government on fighting the COVID-19 via U.S. Agency for International Development. Its significance in the global scenario in addressing COVID-19 was taking action through leading the global health actions, the American Rescue Plan for funding humanitarian needs, and its COVAX distribution to the people.
Despite China being the first place to be hit by COVID-19 pandemic, China was well placed to tackle the disease. It has a centralized epidemic response system, and its success in fighting against COVID-19 can be attributed to the following. First is the adaptable governance to changing situations. Judging from the early warnings and emergency preparedness on period 1, the Chinese government was clearly aware of the shortcomings of the emergency regulations. Since then, many measures of control and prevention have been taken based on the development of the COVID-19 pandemic. Second is the culture of moral compliance. In addition to the adaptable governance to changing situations, the rooted social culture of moral compliance also played a very important role in the fight against COVID-19. Chinese people have a rooted traditional culture to comply with authority and social rules and conform to the public moral standards. Third is the trusted collaboration. A lot of communication efforts between government and people were made. Another measure to mitigate the spike of COVID-19 virus is the application of ABCD plus 5G technology, where the President of China encouraged the use of big data, artificial intelligence, cloud computing, and other technologies to play a supporting role in pandemic detection, virus traceability, prevention and control, resource allocation, and other aspects. The government and various ministries and commissions use ABCD plus 5G technology when they made adaptable governance. The COVID-19 pandemic affecting all countries has underscored both the way China addresses a global challenge and its vision for a better world.
The number of daily COVID-19 deaths recorded in Brazil has climbed above 2,000 people for
Brazil,
the
a country in South America, still experienced the outbreak of COVID-19 pandemic. The Emergency Operations Center of Brazil developed the National Contingency Plan for Human Infection with the COVID-19 coronavirus. They declared that the campaign would be targeted to vaccinate the most vulnerable population, including children, elderly people, health professionals, and pregnant women. Their goal was to facilitate the differential diagnosis between COVID-19 and influenza and reduce the number of people seeking healthcare. To mobilize the health workforce to respond to the emergency situations for outpatient hospital services, the Brazilian Ministry of Health established the Strategic Action, O Brasil Conta Comigo, calling for healthcare professionals. The objective was registering and training healthcare professionals to combat the pandemic. Under this, all health professionals qualified to work in the national territory must register with the Brazilian Ministry of Health through the respective professional councils. Training in the form of distance courses was provided to health professionals. Also, in order to respond to the prospects of increased unemployment and failing income, the government adopted a monetary policy of reducing interest and compulsory rates and measures to expand credit with a temporary relaxation of prudential rules. In March, different fiscal measures adopted by Brazil reached 280.1 billion Brazilian real and aimed at reducing the impact on income, employment, production, and companies, as well as increasing social protection. Brazil's experience showed that this pandemic crisis exacerbated healthcare, fiscal, social, and economic challenges that the country was already facing. However, Brazil also reaffirmed its leadership and coordination capacity, especially in fiscal, health, and economic measures.
With that new daily record of COVID-19 cases in Alberta, Edmonton's largest...
Canada recorded and confirmed its first transmission to have reached the country last January 27, 2020. An individual who returned to Toronto from Wuhan, Hubei, China, tested positive and has contracted the virus. In March 5, the first case of community transmission was confirmed in British Columbia. Thus, all of the country's provinces and territories declared states of emergency. Various protocols that are in hopes to contain the transmission have been implemented, like closing of academic institutions, closures of non-essential businesses, and restrictions on entry. In addition, for the first time in its legislative history, the Federal Minister of Health invoked the Quarantine Act, which has been introduced following the SARS outbreak. The act legally required all travelers returning to the country, excluding essential workers, to follow self-isolation for 14 days. While Canada saw a steady decline in active cases until the beginning of late summer, resurgence occurred in autumn. In September 23, the Prime Minister declared that Canada was experiencing a second wave of the virus. This resulted to variations of regional lockdowns. Again, in December to January 2021, nationwide cases, hospitalizations, and deaths spiked preceding and following the Christmas and holiday season. Further restrictions were put up, resulting to steady decline of active cases. With the third wave coming, further lockdowns and restrictions to the most populous provinces like Quebec and Ontario were prompted. Following Canada's Health Department approval, mass vaccinations began nationwide last December 14, 2020 with Pfizer and Moderna. Additionally, Oxford AstraZeneca and Johnson & Johnson were also approved last February 26 and March 5, 2021 respectively. Currently, the nation has a total of 4 approved vaccines.